Hello, 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 SYNGAP land. My name is Mike Graglia, and this is episode 175 of SYNGAP 10, the SYNGAP1 podcast, which I think I'm going to rename the Cure SYNGAP1 podcast because I'm basically renaming everything Cure SYNGAP1 because I want to just keep things simple for people. We're here to cure SYNGAP1. On that point, I'm going to dedicate this episode to natural history studies. Natural history studies. Why? Because I've had a lot of conversations with various partners in industry lately, and this is coming up a lot. So I'm just going to say it once right here, say my piece, and tell everyone to watch the video. Question one. This is important for everyone to be clear on. What is a natural history study? Why do we care? Let me start with why do we care? We have historically, in the course of humanity, taken people born healthy. When they got sick, we gave them medicine. And when they looked like they used to look, we said, okay, they got better. Pretty straightforward. That's not happening anymore. We now have these kids who are born sick. And we've got these beautiful medicines, these antisense oligos and these gene therapies that we can put into these kids, upregulate gene production, and hopefully bring them closer to normal. But what does a human look like who's been building a brain badly since 9 months before they were born? And then at some point in their life, age 2, 3, 4, 5, 6, 11, whatever, we stick a drug in them and gene expression goes up. What does that look like? We have very little clue. We know that it happens, though. We've seen it happen in Angelman. We've seen it happen in Rett. We've seen it happen in 2A. Catherine has a beautiful spreadsheet about all these different ASO trials that have happened. And we are hoping against hope that there will be ASO trials, plural, for SYNGAP in the near future. Maybe a year, maybe two. But we need a natural history study in order to describe that line of what a Syngapian looks like. So that when we put a drug in that Syngapian and they suddenly look different, we can say the drug worked. Because most Syngapians with this gene mutation type, so I'm starting to think about, I won't go down that rabbit hole. We can say a Syngapian should look like this at this age, but this Syngapian looks like this. And the only way to explain that is the drug worked. So we really need to draw that line. We need to be able to explain what a Syngapian looks like, right? And so a natural history study examines the progression of a disease over time, over time. It can be retrospective, where we look back, or it can be prospective, where we look forward. So retrospective, we go and we get all the medical records and we say what happened in this kid's life. That's what we're doing with Citizen. Prospective, we see him again in 6 months, we see him again in a year, we see him again in 18 months, and we watch how they evolve. Okay? Both are very helpful. We need natural history studies to design clinical trials. We now are blessed beyond imagination to have multiple companies asking us about natural history studies because they're trying to think about clinical trial design. And size and quality matter in these things, right? And then you have different kinds of scales. You have validated scales that are assessed clinically, which means a doctor has to fill in the forms. And then you have PROs, patient-reported outcomes. Both matter, but honestly, I think the clinical scales carry the day. Okay, so that's what a natural history study is, why we care, right? What's going on now, and this is the meat of it. In the United States, we have PROMISE, the prospective, multi-site, multidisciplinary natural history study. This is anchored at CHOP, started 2 years ago with independent donor funding at CHOP. Thank you to that donor and to CHOP for the incredible work you've done. CHOP has already seen over 110 patients. And thank you to SRF's donors who have allowed us to start sister sites at Colorado Children's and Stanford, two exceptional pediatric research institutions, right? So now you can go to CHOP, you can go to Colorado Children's, you can go to Stanford. All that data will go into one IRB, one data set, and then that's for the clinical assessments, and then for the PROs, the patient-reported outcomes, you can use RareX, and that data will flow to all three sites. It is beautiful what has been built, and we are so lucky to have it. That is PROMISE. The SYNGAP1 PROMISE is that natural history study. And what I'm trying to do right now is raise money to get maybe more sites, because the word's getting out, people want to be involved, and to improve the number of people available at these sites for these studies so the data is able to be used for clinical trials. GCP for those in the know. That is our prospective natural history study that has seen over 130 patients, over 110 at CHOP, over 25 at Colorado Children's, and we're just starting at Stanford, so we've seen, I think, 2 or 3 right now. Over 135 patients seen by clinicians in the past 2 years, that data being built and analyzed. Exceptional. Prospective. Retrospective, almost 300 patients in Citizen. If you are in America and you're not in Citizen, get into Citizen ASAP. It's super important. Links in the show notes, citizen.health/partners/SRF. Sign up. They will collect your medical records for you. They will give you all those records in one thing. There's a little chat bot that can go through your records for you. It's beautiful. It's free. And of course, we use that data, analyze that data, license that data to industry, and industry uses that to design clinical trials. And then there's RareX, which I mentioned. RareX is a platform where we can fill in surveys and report that data. And you're like, Mike, I don't want to fill in another survey as long as I live. I get it. Sorry about your luck. We got to fill in the surveys because we need the data because we got to design the trials. That's just in the US of A. In Australia, Dr. Ingrid Sheffer, one of the giants of pediatric neurology and SYNGAP, is also doing an Australian natural history study because, and Dani makes a fair point here, we have data laws, we have national laws, we have all these crazy laws. And so the Australians are doing a study there. Wonderful. That's a very important geography. A lot of great Syngapians down there in Australia. In Argentina, SYNGAP1 Argentina has put together a natural history study, and or a study. They're collecting data. It's not over time yet, but it's going to get there. Great work, Argentina, and maybe we're going to expand that across Latin America. And then in Europe, we have this exceptional EU-funded study called PATRE, being led by, on the patient side, by Verena and her team. And then on the clinical side, there's great clinicians in Germany and Austria working. And we've collected hundreds, I think the number's over 400 patients have filled in surveys there. So there's a lot of data here on Earth about SYNGAP, and we're working as much as possible to connect the dots. But the biggest prospective clinical natural history study is happening right now here in the United States. Over 100 patients seen, ongoing. People are coming back every 6 months. We need you to come back every 6 months, guys. Some of these patients have been seen 4 times already at CHOP, and that data is being collected. What more do you want? Well, let me give 2 messages to industry here. I want industry to hear this because I've had a lot of people in industry calling me and be like, "What's this promise thing?" And we need natural history study data. And SYNGAP1 is exceptionally well positioned to work with and to work on right now, industry. Okay, let's just go through key papers, and I list all these papers in my show notes for you because I'm a nice guy and I want you to have this. Hugoneer, 1998, 1998. That was 27 years ago. Found this gene, right? Found the gene. It wasn't until 2009 that Jacques Michaud in Montreal found 3 or 4 patients who had the same symptoms, who had mutations in SYNGAP1. That's when we had a disease. That's when we had, these kids are sick, and we know the reason they're sick, and it's SYNGAP1. 2009 was 16 years ago. We only found this disease in humans 16 years ago, and I just told you we've had a world-class natural history study at one of the best, some of the best pediatric hospitals in the world running for 2 years. Incredible. But Jacques Michaud in 2009, a little trivia for you, said SYNGAP1 is a NDD, a neurodevelopmental disorder. Gemma Carville and company in 2013, 4 years later, said, actually, no, this is a developmental and epileptic encephalopathy, along with CHD2. A little trivia there. Hope you caught that, Laura Marks. Because of that work that Gemma Carville and company did, Vlaskamp, first author Vlaskamp, last author Sheffer in 2019 published an absolutely beautiful paper and 57 patients studied to describe SYNGAP1 encephalopathy. 2019, only 6 years ago. And that paper is exceptional, and that damn bar chart they put in there is in every presentation about SYNGAP1, including mine. 2 years ago, entirely because of the work and support of SRF, Wrong et al., senior author Dr. Danielle Andrade, who's exceptional, published a paper on adult phenotypes. I want to interrupt myself here to point out that paper had, I think, 14 or 15 patients covered. And we are currently running a follow-up study, which we are funding. And if you are a parent of adult who is not in that study, call me right now. Let's get you in the study. And if you are in that study, but you haven't finished your surveys, please, please, please finish your surveys. I want this next paper to be a much bigger N, and I want the best data in the world. Because the secret's out. People know who Dr. Andrade is. They know who Wrong is, and they want them to study their disease next. It's going to happen. And then I will point out, 2024, last year, Kimberly Wiltrout from Boston Children's Hospital published a paper on the natural history of SYNGAP using citizen data and affirming the results were very consistent with last camp. Why does that matter? Because we used retrospective data and we paired it up with data done by one of the best clinicians on earth with a decent size N, and we got similar findings. So we're really starting to figure out SYNGAP, right? Which is exceptional for a disease we've only had in humans for 16 years. But here's the point, guys. If you look at our census, I got to put the census in this. I got to put the census in these show notes. If you look at our census, in the last census, which was only 2 weeks ago, we announced that there's 1,626 patients with SYNGAP1 that we know about. Right? There's always more. There's always more because there's people who sit and watch forever before they raise their hand and they call us. And that kills me, but you know it is what it is. And so in the most recent SYNGAP census, we announced that there are, can you tell that I'm looking it up on the website because I don't want to get the number wrong? 1,636 patients. 1,636 patients, of which about 450 in the US, right? Why does this matter? Because what somebody told me in a call was they said, well, you know, we're debating, Mike, if we're going to count on your natural history study to give us what we need or if we need to run our own natural history study. And I just between us, I threw up in my mouth. Luckily, I didn't throw up on the screen. That would have been awkward, but I was like, your own natural history study? What are you smoking? Let me explain why industry running their own natural history study would be polite, Mike, be polite. Would be a bad use of resources. Okay. First of all, the biggest resource is human beings. We have 450 human beings in the United States with SYNGAP. Over 100 of them, that's a quarter of the identified patient population, have participated in this study. That's a pretty impressive number by itself. If you were to do another study, you would either take the same patients and ask them to submit to another set of exams with another clinician, with another trip in a different place, or you would have to convince yourself that you could get patients from the other 75% who haven't participated yet to suddenly participate in yours. That's crazy. Problem one. Problem two, industry coming along and sponsoring a natural history study, you're going to spend real money. We're into seven figures here, guys, to get a site, to get clinicians. And by the way, which clinicians are you going to use? Would you like a SYNGAP expert? Because Dr. Knowles, Dr. Abbott, Dr. Helbig, Dr. McKee, they're all already working on ours. Now, yeah, there are other SYNGAP experts. There's Dr. Greenspan, and then there's wonderful people up at Boston Children's Hospital, and we got great people elsewhere. And they all want to be a part, by the way, of Promise. So why would you contract with someone new to run a new study to get to get either old patients or new patients to do something we've already been working on for 2 years with giants? Please do not start your own natural history study. Instead, call SRF and say, hey, we want to contribute to Promise. We want to help you pay these very big bills. Because natural history studies, guys, we were proud of ourselves when we were funding science. Funding science is like cheap compared to funding clinical research. Because doctors cost money, hospitals cost money, everything costs money. You got to have a clinical coordinator because nobody talks to anybody. No one knows what's going on. You got to pay all these people so you can actually get warm bodies in clinic when doctors are there. And remember the multidisciplinary. It's not like you come and you meet a doctor. No, you meet a neurologist, you meet a psychiatrist, you meet a OT, you meet a PT, you meet a motor, all these people. GC. Real money. Real money. And we've been at it for 2 years and we've been supporting it for 2 years. So what I will say to any industry partner is please work with the SYNGAP Research Fund, also known as Cure SYNGAP1, and our exceptional partners at CHOP, Children's Colorado, Stanford, and hopefully more soon with your support, to build a robust GCP natural history study that will provide data and insight that we can use to together design clinical trials. So anyone in industry who's like, yeah, we should work on SYNGAP, maybe it's time to do our natural history study. No, good news. You don't have to. We have been busting our buns over here for free for you guys so that there is a natural history study waiting. And all you got to do is come in and sponsor it. And then you can use and leverage that data and that expertise to design your trials. The goal is not another natural history study. The goal is a trial where we reduce the suffering of the humans and their families with this atrocious disease. I have said my piece. You know my number. Call me if you'd like to talk more. I'm going to wrap this one up. We are in week 29 of the year 2025. There are 28 publications on PubMed. Kind of bums me out, but hopefully we'll pick that up. We are always recruiting for our biobank. If you have not contributed to the biobank, please do. If you are a patient and you want to be notified about all these clinical trials, make sure you sign up on Cure SYNGAP1 Connect. Links in the show notes. If you are not a volunteer, volunteer. Please follow us and join us on LinkedIn, YouTube. We have thousands and thousands of followers there. We want you to be one of them. If you're newly diagnosed, you made it this far, well done. We have resources for you. Reach out with us, register with us. This is a podcast. Like all podcasts, I'd love a 5-star review so I can find more families with SYNGAP and they can know that there is hope and help on the way. This has been episode 175. Thank you for your time.